All right, everybody, welcome back to Table Talk number 3. It's been a quite the gap, long time coming, but we've been focusing on some other things. We've been pretty busy, but we feel like we have some time to schedule out to make these table talks more consistent, give you insight into our business, my brain, which is a scary place sometimes, and kind of like what we're up to and how we can help you, the active, moving, loving person.
Yes. So to start off today's table talk,
Okay.
we are going to be discussing a common theme we've been hearing from current and new clients. Especially it feels like this last, batch of new people, we've been hearing a lot that they've done PT before. So they hear we're PT and they assume or just connected to an experience they had and often say, yeah, actually I went to PT, it didn't fully work, or I still can't do X, or, that's all they know.
Yeah.
And so for our population, which is really specifically athletes, active adults, people who, activity, movement, sport, whatever it is really important in their lives.
Right.
Why is it, Dr. Dan,
Okay.
that traditional PT, even when completed, whatever plan of care was told to you, why for that population specifically are we hearing that it's not working?
Yeah. Good question. Now, we're going to put an asterisk or a caveat to this. This is not saying that traditional in-hour PT practices can't help people. But the individuals that we are seeing, just in our little small sample size, it did not. Okay, so let's just get that off the bat, right?
Okay.
I think with this specific group of people we're seeing that PT didn't help, there's a couple of reasons. I'll try to keep these really succinct and simple. Okay, I think one prong is when you go to an insurance-based practice, oftentimes the insurance is dictating the type of care that you can get, and maybe that person needed something else. Whole nother table talk topic, okay? I think the second thing is potentially the skill set of that physical therapist that they were signed up with, or even like the model of that business, right? So maybe you would see a therapist once and you get put with an aide or a different therapist each time, and that person's unable to get the whole picture thing. The last and third thing is, I think like what we do here a little bit differently is it's a holistic approach. When you go to these traditional practices, if you're there for shoulder pain, maybe they're doing like neck and shoulder, like this region of the body. But I've seen it many times where we can like not treat the shoulder, where it's really the hip, or maybe something going down in the foot or the lower body that could be causing the shoulder to hurt during an activity. So I think those are kind of like the biggest things.
What do you think? And I guess each practice is different.
Yeah.
But if you are coming 2 or 3 times a week, you're doing what they tell you to do, being checked on by an aide or whoever, is that enough? Because I'm wondering, I know a big part that we've been trying to hone in here at Resolve is what happens in between the visits.
Yes.
Getting specific timing for people to come in on their own.
Yeah.
A lot of communication in between. The home program digitally, it's a real change takes time.
Yeah, real change takes time. So
what do you think about that?
Yeah, so again, this is my bias, this is my soapbox here, but like I don't think that traditional therapy practices challenge their patients hard enough, right? So okay, you're there let's stick with the shoulder for example. You might get a templated, their kind of standard plan of care for a shoulder problem, right? Which, like, sometimes that might be enough for somebody, but like most of the time it's not. Like, why does your shoulder hurt? Like sometimes you need behavior change. Like you got to look at their exercise programming. What are they doing outside the clinic? What could be causing a word we use as like interference with their plan of care? And it's not always like exercise related. Maybe it's their stress or their poor nutrition or their sleep or other factors that we need to have conversations around. And I also think that the execution of an exercise matters, what they feel, how they feel it, and all that stuff. So we really coach that very, very well. Yeah.
Gotcha.
Yeah.
What would you say to that athlete or active adult who has taken the time to go to PT multiple times a week,
Mhm.
involved other doctors perhaps, and has either been told this is your new reality, like you can only go this far, or maybe it's time to stop running and find a different hobby.
Yeah.
And they leave feeling like that is their only option. What do you say to that?
That's a tough position to be in as an individual that, let's say, loves running or golf or lifting weights or whatever, and the doctor says like, yeah, I don't think you should be doing this, or the PT's like, you're still in pain, like
we've done as much as we can do.
Feel like, yeah, stop running. I have a client coming in tonight who said those exact words to me, so it'll be curious to see what she looks like. But that's a tough question to answer, because sometimes in reality, like, there are cases where like maybe you need to make a change. Like that is true. But I would say in a majority of people, there are probably other things that can be done. Like, don't give up hope. Like, find a therapist who thinks differently. Don't always like go with what your insurance will allow, which is oftentimes people's like key decision making is like, okay, they accept my insurance. Well, again, like, you're going to be treated by the standards of that versus like what your body truly needs to get better. So it's hard to answer that question. I would say like there's probably a solution that you just haven't found yet.
Yeah.
You haven't found the right person that can help you create a plan, like figure things out, and like not afraid to try stuff. You know, it's not as exact science all the time. It's, you know.
To illustrate this point a little bit more, I think, with like a real life example of something that can happen and has happened here in Resolve, is a high school athlete we had who luckily found us because this athlete has been suffering with pain and went to so many professionals, PT specialists, a lot of
other
things.
types of practitioners in different treatment methodologies.
Looking for solutions. And it had gotten to the point where she was being told, it's time, like, you can't play. This is just where you're at. And not only is it a shame not to be able to play a sport you enjoy, but there was also talk about what that was doing to her mental health as well. So thank goodness she came here, because instead of accepting that, can you tell us what happened once she came in the doors?
So I mean, we had a long conversation. That was the biggest thing. It's like kind of finding out like what she's done, what has worked, what hasn't worked, and like what her big kind of goal is, and like finding out more details, like specifically like what exercises have you done and stuff like that. And then just like I did my typical evaluation, what I would normally do on everybody. We found some things that like we felt were like the biggest rocks to take care of.
Can I ask a quick follow-up question?
Yeah.
Is that stuff you think that has been found before?
I had no idea. Honestly, I don't know. But like what I was able to do is like, I don't say like this one thing is a reason why your back hurts, right?
Right.
It's always a combination of things. But like what we really did, which I think was different than other people, is like we laid out a plan from A to B. How do we get you back to basketball? I laid that out for her, and we tried some things in her first session, and she felt reassured. She felt heard. I think she felt some hope. And she was excited to get going. And like before she knew it, it just organically happened where her back pain started to calm down. We started to do more sport related things, and she was able to handle that. And now she's playing. Like, and it only took a couple weeks. It wasn't like she had to, like, more specifically, to not go on a rant here, but like she needs to know there was no structural damage. Like she had this in her head, like if I do this, I'm going to be worse or more injured. Part of our conversation was like, you can have herniated discs, you can have back spasms, you can have all these little tiny whatever, and like continue to play and it still be relatively safe if we start to continue to build some capacity and endurance and maybe a couple movement capabilities that she didn't have. And she's playing, she's doing awesome. I think she's feeling more confident. She wants to stay and train and like do other things here with us. And yeah, I mean, does that answer your question? Does that?
Yeah, because I just can't help but think, if we hadn't cross paths. You don't know.
But yeah, she was feeling really down about playing basketball, and I think you can see it in her demeanor when she comes in. She's like super happy, ready to get going, and she's has a smile on her face the whole time. It's awesome. It's been really cool to see that change.
Cool.
Yeah.
So, Dr. Dan,
Yes.
to wrap this up,
Okay.
what would you say to the athlete, the weekend warrior, the active adult who either has gone through PT and not quite reached where they want to be,
Right.
or they're not fully participating in
Yeah.
what they enjoy due to pain? What's the message we want to leave with them?
Yeah, I think there's 2 key points here.
Okay.
Okay, and I'll keep them short. I think the first one is you really need to vet your physical therapist, right? You are going to be hiring them, okay, to provide you a service that you need to do to be able to do the things you love. You need to make sure they have the skill set. You need to have conversations with them. Don't just be like, do you accept my insurance, and you make that your driving force to decide where you want to go. Make sure they can help you. And I would say the second big thing is like there's most likely always a solution to your pain. Okay, it might take multiple practitioners. It might take a whole team of people and some active thought and planning. But there's most likely a way that you can be helped and you can live the life that you want.
You heard it here.
You heard it here.
It is possible.
It's possible. Yes. Thank you for listening. Please, follow our Instagram. We're on YouTube. This video is going to go up on YouTube. And ask us any questions that you might have. Talk to you soon.